Thank you, Tim, and good morning, everybody. Maintaining perspective in life is not always easy, especially during this challenging year for all. While 2020 was a difficult year for everyone in healthcare, it's also been very transformational for PainChek, as we can now realise some of the most significant long-term benefits for our business that has evolved during this past period. The transition to a digitally driven world has accelerated at a phenomenal rate due to the pandemic, but it's also really transformed our business, our ability to deliver our product on a global basis. I've been fortunate enough to work with some of the most significant medical developments in history, including the commercialization of diabetes monitoring products with Roche, the cochlear implant with development with Cochlear here in Australia, and also the molecular diagnostics using path labs to actually assess and to diagnose COVID-19. But right now, there's a new technology, a new potentially vital sign that's coming through that's actually making it really transforming everyone here in Australia. So this is PainChek and PainChek product. So PainChek is a software as a service that uses artificial intelligence for the detection of pain. It's clinically validated and commercially approved. We've got 4 peer-reviewed publications that validate the accuracy. We have TGA and CE mark clearance doing FDA right now, and we have patents in Australia, Japan, US, and most recently in China. The goal for us as a business, though, is to be a global business. Australia is really our entry market and our test market. Our goal is to be large global market. And that means on a global basis. We've got more than 900 aged care facilities already under contract and more than 80,000 beds. Being a SaaS business, we have more than 80% gross margins, which is significant, and new products coming through. But the real goal for us is to provide better outcomes for our patients and for our residents, and also increased efficiency. So in health, if you improve care and you reduce costs, you're onto a winner, and that's exactly what we're working on. Next slide, please. So our mission is very simple. Our mission is to give a voice to those people who cannot verbalise their pain. And that includes people living with dementia, they include people with cognitive impairments, and these are significant groups. We do this by taking some of the historical pain assessment methods, which are mostly paper-based and manual, and we automate them. We automate it, and then we add artificial intelligence on top to reduce the subjectiveness and make it a more objective assessment. And that's really what PainChek's about, bringing new tech to old methods and making it easier and faster and better for healthcare providers. Next slide, please. The size of the problem is pretty significant. If you just take dementia alone, there are more than 50 million people in the world living with dementia, growing to 75 million by 2025. And you look at the mix of those people, most still live at home with either home care support or home care packages, but a growing number are growing in moving into aged care. So we're servicing both those home care and aged care markets. The other sector that's what's happening here is that because of the severity of dementia, more than 30% of hospital beds are now being occupied by people living with dementia. And so therefore the hospital sector is another big market opportunity we're looking at. On the other extreme, the other people who can't verbalise their pain are pre-verbal children. As I'll show you today, we've just finished the completion of our pre-verbal children's app, and we're ready to have that regulated and launched into the markets this year. Next slide, please. But we started with Australian aged care because in Australian aged care, this is where the problem is at its greatest for those who can't verbalise. If you look at the demographic there, more than 50%, in fact, close to 60% of the people in aged care either have dementia or have cognitive impairment. And also more than 80% of people in aged care suffer with severe pain. So severe and chronic pain. So this is where we started to really build the product and validate the business model. Next slide, please. The federal government of Australia also recognised the need for PainChek, and they actually gave us a $5 million grant back in the end of just in early 2020 to actually support that drive into the Australian market. This federal funding still continues. And simply what happens is the government funds us for providing the product to aged care for the first year. And all our contracts of aged care are 2 to 3 year contracts, and therefore the client moves to a standard contract with PainChek for years 2 and 3 onwards. I will explain in the next slide how that's moving. So next slide, please. So to date, we have more than 70,000. In fact, as today itself, more than 80,000 beds under contract in aged care, so significant growth. We have over 900 now aged care facilities. These are the December numbers you're seeing in front of you, actually contracted. And our ARR, our annualized recognised revenue, is more than $3 million post the government contract. That's the second years of our standard contracts. The other thing we've done is we actually store every single pain assessment that is carried out on PainChek. So we're building the world's largest database. There's more than 300,000 assessments we've now on our database, and we use that data to improve our products, but also to give feedback to our clients as how they're managing pain and how they're improving their care. And these are all really valuable tools and an added service that we give to our clients. Next slide. Just last week, the Department of Health issued a notice out to all the aged care sector again, reminding them of the PainChek grant, reminding them that 900 facilities already using it or benefited from it, and there's only a certain period to go for them to sign up. That stimulated significant lead generation for us in Australia, and really is establishing us as the gold standard in pain assessments. We've got more than 35 to 40% of aged care beds now covered in Australia. Just as a note, today is the day that the Royal Commission findings will come out on aged care, and so therefore we'll be watching the outcomes of that and respond to that very positively. Next slide, please. So we started with aged care, but now we're moving into home care, hospitals, and we've also started disability. So let me just touch on those other markets as well. So next slide. Next slide, please. Okay, thank you. So I've talked about residential aged care, which you can see on the left. That's actually a $300 million market for PainChek, global market, and we've started very positively across 4 continents already. Disabilities is something new to us. We've started there with a couple of groups there who see the same need to assess pain for people with disabilities. So those are pilots that we're working through now. Next slide, please. In the home care market, we've completed a number of pilots, and that's a larger market. We see that's $1 billion global market. And we've finalised some pilots locally, and we're also doing those in Canada and the UK. So that's a new market segment. And next slide, please. And the hospital sector, we also see that being a large market, around $1 billion per annum for pain assessments. And we've just started this week, in fact, with Ramsay Hospitals in WA looking at frail patients. And that's a study happening with the Ramsay Group. And with Philips Healthcare, we continue to do research and programs with them. Next slide, please. The kids app I mentioned earlier, that's now completed. Our clinical study work is complete. This is a really unique product where we only look at the face. We run a 3-second video of the face, and that assesses the pain severity level compared to a child going through a pain procedure. So the results of that outcome is now being peer reviewed, and we're on track to get CE mark and TGA clearance in Q2 this year. Next slide, please. As I said before, it's a global business. We've now got regulatory clearance in 4 markets. We've got partnerships in 5 markets and a sales presence around the world now. So we continue to expand, and during this year, as the vaccine rolls out for COVID-19, we'll be expanding more into the European markets, Canadian markets, and preparing for the US. Next slide, please. The thing I'd like to talk about today is that we started initially our focus on people who can't verbalise their pain. Now we're expanding. We're expanding PainChek to become the universal pain assessment tool for all people everywhere. So PainChek, as of next month, will be the pain assessment tool for those who can't verbalise their pain, which is our core product. And next slide, please. And now we're introducing within the PainChek portfolio the NRS, numeric rating scale, which allows carers and nurses to document pain for those who can verbalise their pain or can self-report. What that means is that all beds in hospitals or aged care or home care, we can document the pain scores for everybody in those environments under one tool, and then supply the informatics and intelligence behind it to further improve pain management. Next slide, please. What that also means is that sometimes, especially in aged care and hospitals, you get patients who at one moment can verbalise or can self-report, and later on, due to their medical condition, can't self-report. What this means is that the carer, the nurse, can actually document both states at different times on one platform with one tool. And this, I believe, will really help drive care in those sectors. Next slide, please. So in summary, really, PainChek Adult, you look on the left, we've started the journey in aged care, we're moving into home care and hospitals, and finally into GPs. And then with the kids product, we're going to start in hospitals firstly, and then move into home care and other paediatric centres. So big opportunity, big global markets. Next slide, please. So this is finally a catalyst for 2021. The biggest catalyst for 2021 for us is market access expanding due to the vaccine rollout. So first part of this year is really completing the work on the kids app and rolling out the universal solution and the FDA de novo submission. And the second part of this year will be really about expansion into Europe, mainland Europe, Canada, and preparing for the US market in the following year. So lots of good catalysts, and along with the COVID vaccine rollouts. Next slide, please. Final slide. This is a corporate summary. As mentioned before, we're around close to 90 million market cap. We've got more than 12 million in cash, and we've got zero debt, which is very important. Final slide, just for me to wrap up, to say thank you for your time. Look, the PainChek team's done a fantastic job the last year. I've had very fortunate to have some really significant roles in healthcare over the years, global roles. I've never been more proud and certainly more proud of our team and our accomplishments to date. And I believe 2021 will be a really sterling year for PainChek. Thank you for your time. Back to you, Tim.
Thanks, Philip. A great story. Now, quite a few questions here. Just one, you mentioned 3 million ARR, is that right?
Correct.
And some shareholders are trying to reconcile that with some smaller cash flows for the preceding quarter.
Yes. So what we do when we sign the first year of our government grant agreements, we get paid by the government for the contracts. But all contracts we supply are 2 or 3 year agreements. So the years 2 and year 3 is when they switch to our contracts. So if you look at the beds we've got signed up, year 2 of those agreements equate to around a $3 million ARR in year 2 of the contracts. The year 1 of the contracts, we get paid by the government. We've already received $3 million from the federal government so far. In fact, some of it was paid in advance. And so therefore you don't see a big cash flow right now because the government is actually paying us in advance for those beds. So as they transition out of their first year, they'll be transitioning to our own agreements.
And as it's software as a service, what sort of margins do you make?
Oh, as 85%.
85%.
Very,
okay.
very.
And in terms of competitors, there's questions here asking about, do you have any competitors?
We have no competitors. The only competitors are effectively the old technology, the paper-based pain scales. And also we have patents on our technology. We've got trademark on our technology, and our AI is really unique in the way it assesses facial pain features, both for the adults and for the kids. So we're really in a very sweet spot on a global basis. And we've got some potential big collaborations happening with some of the larger partners who have got vital signs monitoring, but they don't have pain. So we can drop in pain into their platforms.
And there's a question here in terms of how applicable is the pain recognition, software as a service across gender and cultural groups and age and medical conditions and things like that.
That's a great thing about this. People's facial features are the same for every race, every gender, everywhere around the world. It's all documented that our facial features, there are about 39 action units on our face, of which 9 are activated when we express pain. What we do is we pick up those 9 features, and that's the same for all gender, all races, everywhere in the world. That's part of our uniqueness and the reason why this works so well.
And do you see the Royal Commission as you said, there's going to be some results released on that. Do you see that as a catalyst for better care by using, applications like PainChek?
Absolutely. I mean, the government, part of our work, part of this work we're doing with the federal government is we've engaged KPMG to do outcome assessments with our users, and that's being communicated back to federal government for policy making. So I said that we see the trial as being a trial to get this going, to improve care in aged care, and then to use the outcomes to see how government then affects, looks at policy making long term for PainChek within aged care. So we're in very close contact with the government on this right now, and we look forward to the outcomes of the results of the Royal Commission.